Imagine this. You're at home alone, maybe relaxing with a good book or watching your favorite show, when suddenly a heavy, crushing pressure grips your chest, your left arm starts to tingle and go numb. Breathing becomes nearly impossible. You're having a heart attack. And no one is there to help. This terrifying reality strikes more than 380,000 Americans every single year who suffer heart attacks while completely alone. But here's the part almost nobody knows. A landmark study published in the European Heart Journal revealed something stunning. Older adults who knew what to do in the first 60 seconds of a heart attack boosted their chances of survival by an incredible 73%. Yes, just 1 minute of the right actions can quite literally determine whether you live or die. Yet here's the shocking twist. 89% of people over 60 have no idea what those life-saving steps actually are. They panic, they freeze, or worse, they make mistakes that drastically lower their odds of surviving. Today, I'm going to share 7 scientifically proven, expert-endorsed techniques that can save your life if you ever face this nightmare alone. These aren't folk remedies or internet rumors. These are evidence-based methods supported by top cardiologists and emergency physicians from leading institutions like Johns Hopkins and the Mayo Clinic. And wait until you hear this. The #1 most critical tip is so effective that researchers at Harvard Medical School found it gives you the same survival advantage as having a trained paramedic right beside you. It's now so essential that 911 dispatchers are being taught to guide callers through it. And amazingly, it has nothing to do with aspirin or any medication. Before we dive in, jump into the comments and tell us your age and where you're tuning in from. We read and reply to every single one. Now, let's get started. 7. Build your emergency communication system. We'll begin with something that seems simple, but becomes absolutely life-saving when every second is working against you. Creating an emergency communication system isn't just about keeping a phone nearby. It's about planning for what actually happens to your body during a heart attack. When cardiac arrest begins, your brain's oxygen supply drops instantly. Within just 15 to 30 seconds, you may become confused, disoriented, or even temporarily unable to move. A study in the Journal of Emergency Medicine followed 500 heart attack survivors over age 60, and here's what they discovered. 67% couldn't remember their own address when calling 911, not because of memory issues, because oxygen loss shuts down clear thinking almost immediately. So here's what you must prepare now, long before symptoms strike. Write your full address, including apartment number, on a bright, highly visible index card. Tape it next to every phone in your home. Add your phone number, gate codes, and any special entry instructions paramedics might need. Program 911 as speed dial #1 on every phone you own. Yes, you can dial it manually, but when your hands are trembling and fine motor control is slipping, one button is vastly easier than 3. Keep your cell phone charged and within arm's reach, especially at night. The American Heart Association reports that 43% of fatal senior heart attacks happen between 10 p.m. and 6 a.m., when most phones are charging in another room. If you live alone, get a medical alert device and wear it at all times, even in the shower. The National Institute on Aging found that 31% of seniors who own these devices weren't wearing them when their cardiac event occurred. A waterproof model costs only a bit more, and that tiny upgrade could be what saves your life. Finally, tell your neighbors if you have heart issues. Give a trusted neighbor a spare key. Ask them to check on you if they hear anything unusual or notice you breaking your normal routine. If you live in an apartment, inform your building manager or doorman. They can give paramedics immediate access, shaving off precious minutes. Now let's move on to the next strategy, one that can buy you crucial time when every second matters. 6. Master the cough CPR technique. This next technique has sparked debate for years, but recent studies have finally clarified when it can help and when it absolutely should not be used. Cough CPR, also called cough resuscitation, works by creating powerful pressure shifts in your chest. These pressure changes can help keep blood flowing to your brain when your heart rhythm suddenly becomes dangerously abnormal. In a study from Ping Union Medical College that followed 240 patients trained in cough CPR, those who used the technique correctly stayed conscious an average of 92 seconds longer than those who didn't. That may not seem like much until you realize it can be just enough time to dial 911, unlock your door, or grab essential medication. Here's exactly how to perform it properly. At the very first sign of heart attack symptoms, before you feel faint or dizzy, take the deepest breath you possibly can. Fill your lungs to the absolute maximum, then cough forcefully and deeply, as if trying to push something up from the very bottom of your chest. This cough must come from your diaphragm, not your throat. Repeat this cycle every 2 seconds without stopping. Deep breath, strong cough. Deep breath, strong cough. The rhythm must be steady, strong, and continuous. What's happening inside your body is remarkable. Every deep breath loads your lungs with oxygen. Every forceful cough squeezes your heart, helping push blood through your arteries, essentially acting as a temporary manual pump when your heart isn't beating correctly. But this next part is absolutely critical. Cough CPR only works if you're still conscious, and only during specific dangerous rhythm disturbances. It will not help and can even be harmful during a full heart attack caused by blocked arteries. That's why this technique should never replace calling 911. Use it only as a bridge to keep yourself conscious while emergency help is on the way. The Cleveland Clinic emphasizes that it's most effective in the first 30 to 60 seconds of symptoms, which is exactly why learning it now matters. When the moment strikes, you won't have time to look it up. Now, before we dive into medications, which might surprise you if you're finding this video helpful, tap that like button so more seniors can discover it, and make sure to subscribe. We're bringing you powerful, life-saving senior health tips every single day, and you won't want to miss what's coming next. Number 5, the aspirin protocol. That actually works. Most people know that taking aspirin during a heart attack can save your life. But what nearly everyone gets wrong is how to take it, and the correct method can make aspirin work up to 50% faster. According to the Harvard Heart Letter, the way you consume aspirin during a cardiac event dramatically affects how quickly it enters your bloodstream. Here's why aspirin matters. During a heart attack, a blood clot forms inside a coronary artery, cutting off oxygen to your heart muscle. Aspirin reduces how sticky your blood is, helping prevent the clot from growing and allowing blood to slip past the blockage. A massive study published in The Lancet, involving over 17,000 heart attack patients, found that taking aspirin within the first hour reduces the risk of death by 23%. But here's the crucial part. Almost everyone does wrong. You must chew the aspirin, not swallow it whole. Chewing breaks apart the tablet's coating and increases its surface area, allowing the medication to be absorbed directly through your mouth's lining. You don't have to wait for it to dissolve in your stomach. Researchers at the University of California, San Diego found that chewed aspirin reached life-saving therapeutic levels in 14 minutes. Swallowed aspirin took 26 minutes. In a heart attack, those 12 minutes can be the difference between survival and irreversible heart damage. Here's what to do. Take 325 milligrams, 1 regular aspirin or 4 baby aspirins. Chew it thoroughly, even if it tastes terrible. If all you have is coated or enteric aspirin, chew it anyway. Speed matters more than taste. Keep non-coated aspirin in multiple places: your home, car, purse, and wallet. Check expiration dates every 6 months and store tablets in their original bottle to protect them from moisture. Also important, if you already take daily low-dose aspirin, usually 81 milligrams, You should still take the full emergency dose during a suspected heart attack. The preventive dose is not enough in an acute event. But of course, never take aspirin if you're allergic or if you're on blood thinners like warfarin without discussing emergency protocols with your doctor beforehand. Now let's talk about a simple body position that can increase your chance of survival even further. Number 4. Assume the cardiac position. The way you position your body during a heart attack can dramatically influence blood flow to your heart and brain. In fact, guidelines from the European Resuscitation Council show that proper positioning can keep you conscious up to 40% longer during certain cardiac events. Here's exactly what to do. If you're experiencing symptoms, do not lie flat on your back unless you're on the verge of losing consciousness. Lying flat can decrease blood return to the heart and worsen symptoms. Instead, move into a 45-degree upright position, known as the semi-Fowler's position. You can do this by leaning against a wall, stacking pillows behind your back, sitting upright on a couch or bed. Your knees should be slightly bent with your feet flat. This position helps in 3 major ways. Reduces strain on the heart by using gravity to assist blood flow, improves breathing by allowing the diaphragm to move freely, prevents fluid buildup in the lungs, which often occurs during heart failure. A study from Tokyo Medical University found that heart attack patients who use this position had 35% better oxygen saturation than those who stood, reclined, or lay flat. But if you start to feel faint, lower yourself to the floor slowly using furniture for support. Don't collapse once down. Lie on your side, not on your back. Use the recovery position, right side down, left knee bent for stability. This protects your airway if you lose consciousness and prevents choking if you vomit, which happens in about 30% of heart attacks. Next, loosen anything restricting your breathing or circulation. Unbutton your collar. Remove a tie or scarf. Loosen belts or tight clothing. The Journal of Cardiac Nursing found that simply loosening tight clothing can improve oxygen levels by up to 8% during cardiac distress. Finally, keep your environment cool. Heart attack symptoms often cause sweating, but piling on blankets can overheat your body and increase the heart's workload. Open a window if possible, but don't go outside. If you collapse, no one might see you. Now get ready, because the next tip goes against what most people believe, but it is scientifically proven. Number 3, the controlled breathing method. When a heart attack strikes, your body's natural instinct is to panic, and that usually means rapid, shallow breathing or full-on hyperventilation. But this reaction can make the situation dramatically worse by reducing the oxygen that reaches your heart and brain. Stanford University Medical Center conducted a study of 300 cardiac patients and found something remarkable. Those who used controlled breathing during their heart attack had 45% less heart muscle damage than those who hyperventilated. The technique is called paced diaphragmatic breathing, and here's how to do it correctly. Inhale slowly through your nose for a count of 4, letting your belly, not your chest, rise. Hold your breath for 4 seconds. Exhale slowly through pursed lips for a count of 6, as if gently blowing out birthday candles. The longer exhale is the magic. It activates your parasympathetic nervous system, which slows your heart rate, lowers oxygen demand, reduces blood pressure, prevents the dangerous hyperventilation spasms that can worsen a heart attack. Research from the Mayo Clinic shows that proper diaphragmatic breathing can lower heart rate by 10 to 15 beats per minute, easing the strain on your heart when it needs help most. To get it right, place one hand on your chest and one on your belly. The belly hand should move more. If your chest hand is rising, you're not breathing from the diaphragm. Practice matters. The American Journal of Cardiology found that patients who practiced this technique just 5 minutes a day were able to use it correctly during emergencies 78% of the time, compared to only 12% for those trying it for the first time during a heart attack. If you can speak, count out loud. This keeps your rhythm steady. And if you're on the phone with 911, it tells the dispatcher you're still conscious. Now let's move to something most people have never heard of, but it saves thousands of lives every year. Number 2. The emergency door unlock and signal protocol. This life-saving step addresses a terrifying but common scenario. Paramedics arrive, but can't get inside your home. A study in the Journal of Emergency Medical Services tracked 8,500 cardiac emergencies and discovered locked doors delayed treatment by an average of 11 minutes. 34% of cardiac-related senior deaths occurred because help couldn't reach them in time. Here's exactly how to prevent that from happening to you. The moment heart attack symptoms begin, unlock your front door. Do this before calling 911 or performing any survival technique. Walk to your door immediately while you still have strength, coordination, and mobility. If possible, leave the door slightly ajar. The University of Pennsylvania found that patients who unlocked their doors as their first action had 47% higher survival rates. Why does this matter so much? Because the average person loses the ability to walk within 3 to 5 minutes of a major heart attack. Once you're on the floor, you're not getting to that door. Install a lockbox outside your home and give the combination to your local fire department. Register it on a non-emergency call. According to the National Association of EMTs, lockboxes reduce entry time by 8 minutes. Turn on every light you can. Paramedics say a brightly lit home stands out instantly and cuts searching time by 2 to 3 minutes. During daylight, hang something bright on your front door or window to help responders spot your home. If you live in an apartment, call 911 first. Then immediately call your building's front desk or security. Urban Emergency Medicine found that doing this cuts response time in high rises by 6 minutes. Keep a whistle on your keychain and in your nightstand. Even if you can't yell, you can still make noise to guide responders. Create an emergency information sheet and tape it to the inside of your front door at eye level. Medications, allergies, conditions, name. The American College of Emergency Physicians reports this reduces treatment delays by 26%. If you can afford it, smart locks are even better. Some systems unlock automatically when 911 is called from your phone. The Cleveland Clinic found these patients received treatment 31% faster. A locked door has cost thousands of seniors their lives. Don't let it cost yours. Number 1. The immediate nitroglycerin protocol. What that Harvard Medical School study uncovered shocked even seasoned cardiologists. Patients who used nitroglycerin correctly within the first 3 minutes of heart attack symptoms had survival rates nearly identical to those who received instant paramedic treatment. That word, correctly, is everything. Many people who carry nitroglycerin have no idea how to use it properly during a crisis. Nitroglycerin works by rapidly relaxing and widening your blood vessels, easing the heart's workload, and boosting blood flow through partially blocked arteries. Used fast and used right, it can actually halt a heart attack in progress, provided the blockage isn't fully closed. A massive British Medical Journal study of 12,000 patients found early nitroglycerin use cut mortality by 35% and slashed heart muscle damage by up to 50%. If you're over 60, have high blood pressure, diabetes, high cholesterol, or a family history of heart disease, talk to your doctor now about an emergency nitroglycerin prescription. At the very first hint of heart attack symptoms, sit down immediately. Never take nitroglycerin standing. Your blood pressure can drop so fast that you pass out. Place 1 tablet under your tongue. Not on top. Not swallowed. The rich blood vessels under your tongue absorb it in seconds. Let it fully dissolve. About 20 to 30 seconds. A tingling or burning sensation means it's working. Set a timer for 5 minutes. If your symptoms haven't significantly improved after 5 minutes, take a second tablet. Wait another 5 minutes. If symptoms persist, take a third tablet. And call 911 if you haven't already. Never exceed 3 tablets in 15 minutes. The Cleveland Clinic found that patients who followed this exact pattern had 67% better outcomes than those who took nitroglycerin randomly or waited too long between doses. Nitroglycerin loses strength fast when exposed to air, heat, or light. Keep it in the original amber glass bottle. Never transfer it to another container. Replace it every 6 months, used or not. Store multiple bottles in places you spend time, your nightstand, kitchen, living room, and car. Avoid bathrooms and glove compartments where heat and humidity ruin it. Write the opening date on each new bottle. Fresh nitroglycerin will usually cause a slight headache or tingling. If it doesn't, it may no longer be effective. If you take erectile dysfunction medications like Viagra, Cialis, or Levitra, you must not take nitroglycerin within the next 24 to 48 hours. Combined, they can trigger a deadly drop in blood pressure. Keep a medication card in your wallet so paramedics know exactly what you've taken. And one more vital step, chew an aspirin before taking nitroglycerin. Johns Hopkins reports that the combination of aspirin's anti-clot effects and nitroglycerin's vessel-relaxing power boosts survival rates by 58% compared to taking either one alone. These 7 techniques can literally determine whether you survive a heart attack when you're alone. But the time to learn them is now, not during a crisis. Practice the breathing routines daily. Check your aspirin and nitroglycerin supplies monthly. Ensure your emergency communication system works today, not tomorrow. Share this information with every senior you know. Heart disease kills more adults over 60 than any other condition, yet knowledge and preparation dramatically increase survival. Print these instructions and keep them somewhere visible. In the middle of a cardiac emergency, you won't be able to rely on memory. A simple guide within reach could save your life, and remember, these techniques buy you time. They do not replace medical care. With U.S. emergency response times averaging 8 to 12 minutes, these steps can keep you alive until help arrives. Your heart and your loved ones will thank you for being prepared. Now we want to hear from you. Have you or someone you care about ever faced a heart emergency alone? What's one thing you wish you'd known beforehand? Share your story below. It might save someone's life.